Good evening. This is CTV News for Wednesday, January 25th. I'm Denise Douglas.
And I'm Patricia Malone. Glad to have you with us tonight. Well, the Prince George's delegation continues its fight to bring home millions of dollars for the new hospital. Today, County Executive Rushern Baker, along with members of the council and others, went before the Senate Budget and Taxation Committee in Annapolis. CTV's Sonia Srivastava has more.
Stop playing a shell game with people's lives.
Those stern words for the governor from Rushern Baker as he and the entire Prince George's delegation, including members of the State House and Senate, along with county council members, try to make their voices heard today in Annapolis. Last Wednesday, Governor Larry Hogan released a state budget that would slash $22 million from the new regional medical center in Largo. Baker says the move would put funding at less than $30 million required by state law. Many, including Mike Miller, are accusing Hogan of going back on the deal, and adding fuel to the fire is the recent approval of a cardiac unit at Anne Arundel Medical Center, which would jeopardize the viability of the new Prince George's facility by potentially pulling away patients.
Every time we get there, the post gets moved further away.
That's right.
It's either the executive branch who's not putting in the money that was required by law to make sure that the existing facility, as it grows, as it continues to enhance its existing cardiac unit, is ready to move into the new facility that we're going to break ground this year.
Executive branch of the state government going against existing policy, existing law, and existing investment is a real danger to health care in Prince George's County.
We have embarked on several key initiatives to improve the delivery of care as well as to improve the financial health of the organization. But it does require substantial financial investment. It does require a new regional medical center so that we can recapture the flow of patients outside of the Maryland area into the Washington, D.C. area.
Now, the hospital is slated to open in 2020, and you're looking at the site here next to the Largo Town Center where it would be built. Now, today, County Executive Rushern Baker also added that for the state to cut funding at this point in the game would also be not good for them, since they've invested so much money in all of it so far themselves. In Largo, I'm Sonia Srivastava. Back to you.
And in the past, Governor Hogan's office has responded by saying the agreement which was signed is, quote, flexible and not being violated. Well, pressure mounts for GOP lawmakers to craft an alternative to the Affordable Care Act following President Trump's executive order dismantling the massive health care law. Now, one Republican proposal would permit insurance companies to sell plans across state lines. But economist Peter Morisi says that will not solve the cost problem through competition. In a recent editorial for the Boston Herald, the business professor writes that the new president and Congress will have to accept government regulation of prices in the private marketplace, or repeal and replace will fail. He also says the Affordable Care Act has not delivered on its promise to lower costs.
Supposed to lower costs by getting healthy people to sign up, but in reality, it didn't work out. Too many people didn't sign up. Most of the folks that didn't have health insurance before still don't have health insurance. And a lot of states chose not to participate in the Medicaid program. Republicans say we can encourage interstate competition by permitting, say, insurance companies to sell across state lines. There's two problems with that. One is, it's not the insurance companies that are the problem. It's the price of medical services, the prices that hospitals charge, of drugs and medical devices, doctors' fees, and so forth. The other is...
Now, Morisi also says that Republicans just can't repeal the law because it will be difficult to restore private plans that are lost in the disruption.
Well, the search is over for a man accused of shooting a woman at a school bus stop in Oxon Hill. 42-year-old Roland Sims turns himself in today. Sims is being charged with attempted first-degree murder, reckless endangerment, and other charges. At the intersection of Chester and Winthrop Streets yesterday morning, Sims allegedly approached a woman. They argued, fought, and he allegedly shot her. At the time of the incident, 6 children were waiting at the bus stop. None of them were injured. Prince George's police are investigating the death of a man killed by a freight train this morning. It happened at around 7 in the morning near the MARC train station in Riverdale Park. Sources say the locomotives and several cars passed the individual who was walking on the tracks when he fell towards a moving train and was hit. The incident forced the suspension of MARC service on the Camden line. Police say they don't suspect foul play and are looking into the cause of death, including whether suicide was involved.
That's something that would certainly be part of the investigation. There are some steps that we take to, speak with individuals that were on the train, what they saw, and some other data that we can collect. So suicide is something that we would certainly consider, but there's certainly other factors as well.
MARC service is expected to be back to normal for the evening rush. You are watching CTV News. I'm Denise Douglas.
And I'm Patricia Vallone.